Hello again, everybody. Welcome to OneClickMed Live. I'm Chris Coraggio, coming to you from the social media studios, and today we're talking about cancer treatments, and joining us is Dr. Michael Musci, a medical oncologist from Ironwood Cancer and Research Center. Dr. Musci, thanks so much for being here.
Oh, thank you. I'm glad to be here.
Great. So you deal with a lot of patients with breast cancer, lung cancer, prostate, colon cancer. Are there any specific advancements in chemotherapy in recent years when you deal with these patients?
Oh, yeah. I think that treatment of patients is much more sophisticated nowadays. I mean, oncology treatment has been advanced not just in the effect on the cancer itself, but in the ability to tolerate therapy. Not just in the fact that there's more supportive medications and better ways of getting through this difficult treatment, but there's actually better therapy. And the oncology field in the last decade has been transformed by targeted therapies, which are targeted at a specific signal in cells, basically shutting off the signal, telling them to grow. And a lot of these therapies happen to be a lot more tolerable. Less hair loss, less fatigue, little GI side effects, so nausea is much less of an issue. And so we're able to control cancer with agents that are much more sophisticated nowadays, and patients are getting through them with less side effects.
Yeah, less toxic, if you will, overall in chemotherapy treatments. Well, that's wonderful news to hear. I want to ask you about bone marrow and blood cell disorders, because I know you deal with a lot of that. What sort of technologies are we seeing in those areas?
Yeah, so again, I do see breast, colon, lung cancer. Those are very common malignancies that any general oncologist would see. But over the years, I've sort of gained interest in leukemia and lymphoma, partly because there's been particular advances in those particular diseases with targeted therapies. Some of this is years ago, actually. So therapies such as Gleevec, FDA approved in 2001, has transformed CML, chronic myelogenous leukemia. The natural history is forever changed by an oral therapy that works for decades in some patients, but certainly for years in some patients. And there's a whole family of drugs related to that, some of which are more effective and more tolerable. So that's just for one particular disease. But with lymphoma, there's antibody therapy directing the immune system against the cancer cells, or targeting a radioactive isotope to the cancer cell. And for multiple myeloma, another disease that the natural history is completely transformed. It used to be a disease where patients would succumb to the illness in perhaps 2.5 years on average, and now patients have many treatment options, some of them oral, often working through different pathways in the cells, trying to shut them off. And these sophisticated modern drugs are really changing the course of oncology completely.
Thanks so much, Dr. Musci. Such useful information. And if you'd like to learn more about some of the topics discussed here today, just head on over to ironwoodcrc.com. They have facilities all over the valley. The two in Mesa that Dr. Musci works at, we're going to give you the phone numbers for those, 480-981-1326, or the one on Dobson, 480-969-3637. Once again, thanks, Dr. Musci. We appreciate your time.
Thank you very much.
This has been OneClickMed Live. Remember to join the leading medical network online, OneClickMed.com, the portal to your global medical community. I'm Chris Coraggio. We'll see you next time.